the information that I'm going to be presenting to you today is based on data from our latest Kids Count report, data that focuses on health and well-being of Illinois children. And we try to disaggregate the data whenever possible by race and ethnicity. And in today's presentation, we're going to be focusing on the health status of Latinx children in the state of Illinois. So I'm going to go over these fairly quickly because I know we got a bit of a late start. First off, before I get started though, just a quick note about the data we're going to be looking at today. We're going to see significant racial and ethnic disparities across pretty much every single metric we're going to go over today. The position that we take is that racial and ethnic disparities persist because racism persists, and not because of physical or genetic or cultural or biological differences among races and ethnic groups. So I want to emphasize that before I go forward here and go through the data that we're going to be looking at. Now, before I get into the health data, I do want to put this into some context. The context is one of change in the state of Illinois over the last 10 to 20 years. So in between these 2 5-year periods here from 2009 to 2013, to that 5-year period of 2014 to 2018, Illinois' child population decreased by almost 159,000 kids. The child population decreased across most counties, 87 of them, and there were only increases in 4 of the state's 102 counties, and 11 counties saw no statistically significant change. These changes are also taking place in the context of racial and ethnic changes that are taking place in the state. So we see that there are significant decreases in the percentage of children in the state who identify as Black and white, not Latinx, and there are significant increases since 2000 in the percentage of the population, the child population that identifies as Latinx of any race. And in fact, when we look at the population of Latinx kids by county in the state, the chart or the map on the left here shows that the percent change in the raw number of Latinx children has in many cases decreased. But because we're seeing significant decreases in the percentage of, say, for example, white and Black children in the state, their share of the population in the map on the right shows that their population share has actually been increasing in a variety of places throughout the state. Now, about 914,000 people in the state of Illinois are foreign-born and not U.S. citizens, and 57% of those folks were born in Latin America. That's about 522,000 people. This can include either folks who are either documented or undocumented. The Census Bureau does not make any distinction between the two. They don't ask like a citizenship question in that regard. But the American Immigration Council estimates that in 2016, there were 400,000 undocumented immigrants from any country living in the state of Illinois. Now, all of these demographic changes are taking place. And so we have to keep that in mind when we're looking at various health metrics for children by race and ethnicity throughout the state. And I'm just going to really quick go through some of the specific health metrics that we decided to focus on today. So first of all, the data show that Latinx children their parents rate their oral health problems such as like toothaches, bleeding gums, decayed teeth, or cavities. They actually have the highest rate of these oral health problems throughout the state overall, and when we compare them to children of other races and ethnicities. We also know that Black and Latinx children ages 10 to 17 have body mass indexes at or above the 85th percentile at higher rates than the state overall and other groups of children. And even though the percentage of children overall in the state who are uninsured is relatively low, we do see that Latinx children and children who the Census Bureau identify as other are uninsured at higher rates than other groups in the state as well. Some of those differences to a statistically significant degree. We also know that for people who are foreign-born and not citizens here in the state, their uninsured rates, and that's the rate for everybody, not just children, their uninsured rate is quite a bit higher than folks who are native-born and people who are foreign-born and who have gotten their naturalized citizenship. And in fact, when we look at data over time, at the percentage of children who are uninsured, the blue line there represents Latinx children since 2009 all the way up to 2018. And the orange line is just children overall in the state. And we see that Latinx children are uninsured at significantly higher rates over this time span. These might not always be statistically significant differences, but we know that there are differences that exist here. And so that our job is to try to close this gap. So finally, we're looking at things like blood lead levels. We see that Latinx children actually have blood lead levels that are fairly similar to other children throughout the state, except for Black children who have significantly higher levels of blood lead, and that's again statewide. And we know that there's no such thing as a safe blood lead level to have. So our goal is to of course, get this down to 0, but there are some significant differences here we can see by race and ethnicity. So, just to quickly summarize, Latinx children have more oral health problems than the overall population and other racial and ethnic groups. They have higher rates of obesity than the overall population. They lack health insurance at higher rates, but in general, they also have lower blood lead levels than Black children and similar blood lead levels to those of other groups. Now, we also include information about adverse childhood experiences because the data on, there's really not a whole lot of data on children's mental health in the state. So we use data on adverse childhood experiences as sort of a stand-in to kind of measure the kinds of experiences that children are having that might contribute to poor or better mental health. And we know that, for example, by race and ethnicity, family income Illinoisans who found it somewhat often or very often hard to get by on a family income since the birth of a child is significantly higher for Latinx and Black families in the state. Black and Latinx children face higher rates of neighborhood violence. And most concerningly, Black and Latinx children also have experienced being treated or judged unfairly because his or her racial or ethnic group. So all these things kind of stack on top of one another and contribute, we believe, to a poorer mental health among Black and Latino children. Now, some of the most concerning data that we looked at was the data on infant mortality in the state of Illinois. The Black infant mortality gap, which is that line, that pinkish line at the top, that gap has existed since data collection started in the 1920s. And the problem is that this gap is still not particularly well understood, but that gap has always existed, even though the rate of infant mortality has been consistently going down since they started collecting these data. All other racial or ethnic groups fall below the state rate, and that includes Latinx infants as well. Some of the contributors to this infant mortality gap might have to do with Black women having higher rates of low birth weight children and getting less frequent medical attention early in pregnancy. And epidemiologists are starting to pay some newer attention to the chronic effects of anti-Black racism. But why this gap exists still is going to require a lot of research, because they're still not entirely sure why the gap is so much wider for Black infants, not just in Illinois, but nationwide. What we do in our report is that we try to connect the health problems that children are facing to their socioeconomic circumstances, and this is where we get into the social determinants of health in the state. And epidemiologists have long known that social inequalities are major contributors to health inequalities. So, the water that we drink, the air we breathe, how closely we might live to a grocery store, whether or not you live next to a factory, how much money your household brings in. Epidemiologists argue that these factors might in fact have more to do with health outcomes than any kinds of personal decisions that we make regarding our health. And what we see when we look at the social determinants of health is some very significant racial and ethnic disparities. So when we look at the percent of children at various levels of poverty, we see, for example, that Black, other, and Latinx children of any race are at 200% of the federal poverty, at or below 200% of the federal poverty level, at higher rates than the state rate and other racial racial and ethnic groups. These numbers start to, as you move to the right, and we get to lower or higher levels of poverty, these numbers start to reach more parity with the state rate, until we get to the percent of Illinois children at or below 50% of the federal poverty level. And I want to emphasize this here, that Latinx children are actually at 50% of the federal poverty level at lower than the state rate. And they have more or less reached parity with other racial or ethnic groups, except when it comes to Black children, who face this kind of deep poverty at much higher rates than other racial or ethnic groups in the entire state. And when we look at areas of concentrated poverty, the percentage of children living in areas of concentrated poverty, 34% of Black children live in areas of concentrated poverty. And the Annie E. Casey Foundation defines areas of concentrated poverty as any census tract where the poverty rate is 30% or more. So we can see that among Black children, at least, poverty is quite a significant issue. And the next group down from that are Latinx kids who match the state rate at 9%. To put this in contrast, only about 2% of white children who are not Latinx live in areas of concentrated poverty. So there are some very significant differences here in the kinds of, we would argue, resources and the resources that are available to children in these areas. Now, just over 50% of Latinx Illinoisans work in these 5 categories here, and they're overrepresented in areas of production, food preparation, and building and grounds cleaning and maintenance, and they're underrepresented in sales. And we're going to go over some COVID-19 data in a few slides, and we would argue that because of their overrepresentation in areas such as production and food preparation, this is going to put a lot of Latinx Illinoisans at risk of higher rates of COVID-19 infection and therefore higher rates of COVID-19 related deaths. But we're going to go over that data in a little bit here. We also find that Latinx children ages 3 and 4 are enrolled significantly less in school, so they're not getting the benefits of early childhood education as much as other groups in the state, and to a certain extent, then their kindergarten readiness is then rated lower than any other group throughout the state. To talk a little bit more about this, we've got Maricela Garcia, who is the Chief Executive Officer of the Gads Hill Center, and she's going to talk a little bit about these disparities we see. Maricela?
Yeah, thank you. I am on mute, right? Everyone can hear me?
We can hear you.
Okay, so good morning, everybody, and thank you for the invitation to share the experience of Gads Hill Center in relation to the very challenging information that you presented here. One of the issues that we addressed right away when the pandemic, when the state took the measure to close sectors of the economy, was to try to understand what impact that decision was going to have on the families that we serve. Gads Hill Center serves 3,000 children and their families every year, and from programs, based on programs from Head Start to preparing them to go to high school. So our focus is children and youth. And the tenet of our work is to make sure that they do well in the school. But they will not do well in the school if they don't have the supports that they need. So one of the major issues for us is understanding poverty and try to push the debate on poverty to the center of the national policy conversation. So to do that, we started collecting data from the very beginning of the closing. We moved our programs online, and the first survey that we sent was for the families to let us know if they had the technical and technological understanding and capacity to participate in the programs online. And the first thing that we found is that more than 1/3 of the 951,000 families that we surveyed that responded to the survey indicated that they did not have computers or tablets at home, or they did not have access to the internet. So that was the first revelation to us to see how limited those families are because of how expensive those access to technology is for a very significant number of families. So then we started collecting the data more on needs. Once we bridged that digital divide by buying tablets and finding some hotspots, then we started looking at other needs in order to respond more effectively. And what we saw, it was that right away at the end of the month, in just 2 weeks, the families moved from needing assistance for food, for diapers, formula, into I don't have money to pay for rent and I don't have money to pay for utilities. So even when, in order to qualify for our programs, families have to work. So the very precarious situation for low wage families is very serious. And I think that the COVID opened the curtain for us to be able to see how ugly it is. So then we started prioritizing the emergency money to avoid the evictions by then putting that into paying, helping the families pay for rent. Something that I remember that was so touching for me was that the families, many of them, had very little money saved for emergencies, not to be able to even cover the expenses of a month, but they know that they knew that they had to be saving some money. But right away, when we knew how much need they had, they asked us if they could just give us a little bit because they had $1,000. If we gave them 500, they would be able to pay rent. I think that to me, it was the dignity of poor families that they are not asking for any handouts. They really protect their dignity by asking just for a little bit to bridge them. But I think that the prolonged time that they were unemployed was really hurt them to the point that right now, unless they have been able to recover their job, they are in very precarious situation, and we continue raising funds in order to support them. Why that then brings me to the conversation about mixed status families. All our children are US born, the children that we serve, but more than 1/3 are in mixed immigration status families. So that means that one of the parents might be a citizen or a permanent resident, legal permanent resident, and one of them is undocumented. So that puts the family as a whole in a very precarious situation because in most instances, those families were not able to get the money from the stimulus check or eligible for unemployment. So we continue to see the crisis in that family composition. We also noticed that the emergency became very evolved into we don't have money for medicine because a portion of them, when they lost their job, also lost the medical insurance. And but the interesting thing in the data that we collected was that 1/3 of the 951, and I have the data here, 200 out of the 951, 324 didn't have health insurance to begin with. And about 35 lost the insurance due to the layoffs that they experienced. So the reality is that they don't have health insurance, that more than 1/3 of working people don't have health insurance. So I think that there's big policy questions now that we have a better understanding of the precarious situation that people who are doing the best they can because they're working, but it's poverty that is structural. It's not their fault. It's not that they're not doing what they're supposed to be doing to advance the family. It's that the policies that we have undermine any possibility of working families to be able to lift themselves out of poverty through work. Thank you.
And I know we have a few more minutes here, and I know we have wonderful providers on the call with us. We were just wondering what you may think are things that are contributing to low Latino access to early childhood. Please feel free to use the chat box or unmute yourself, because a lot of you work with one another in our Acuerdo network, but there are people even beyond our Acuerdo who want to engage Latinos in early childhood programs better. And so this might be an opportunity to just share what has been done and what can be done to really close that gap a little bit more.
So Erica, just to make sure, you're asking me what we have done to be able to enroll?
Yeah, you or other providers that are
Sure.
on the call as well. It could be in dialogue between all of us.
Sure. So I think that let me just say a couple of things. So we, our staff is bilingual and bicultural, and that is so critical, because it's not that we need to bring a translator in order to reach out to the families and be able to feel them welcome and connected. It is because we make an effort to hire people with the language and cultural capacity to engage and understand the families.
It's critical. And I think that's something that a lot of us are investing a lot of energy in, trying to figure out how we build that capacity, not just in the city, but outside of the state, where Latino families also, I think, experience challenges related to relating to people in their home language. We also have a few members of the chat box saying that there is a fear about sharing personal information and language barriers. Abby, do you want to talk a little bit about this first point here regarding sharing personal information?
Sure, absolutely. I definitely, in any services that I'm with YWCA Metropolitan Chicago, and any services that we offer in the Project Health program, there is always a fear of sharing that information from our clientele, because maybe they're undocumented or they have family that's undocumented. So we are very careful in making sure that we secure that information and make our clients feel safe, that this is a safe place for them to be and to share that information with us.
Do you feel like there are effective ways that you guys have been able to do that and make them feel safe in doing it? Maybe things that are best practice for others on the call who are experiencing a similar challenge?
Well, I definitely appreciated what was said. Versus bilingual and bicultural are for sure two different things. And so our staff works hard to identify and connect and build trust with our families from the very beginning, and that can definitely take time. It's more difficult in the virtual world. But some of those questions that we know are a little scarier and are a little more personal, we might give that some time before we ask that question to our clientele. And in asking the information to our clients, will give them an opportunity. If it's information that I don't need at that moment, I'll give them an opportunity to opt out and let me know a little bit later, so I can build trust with them, because trust is definitely a key in that area with our families.
Wonderful. And I think we have another really great point in the chat box around generational differences in the ways folks are parenting. And so how are we really encouraging the importance of early childhood education with parents? That's something that I think we're particularly worried about, especially as COVID has been affecting the community. We don't want to talk about learning loss or ways in which kids need to catch up. We really want to shift the rhetoric in a more positive direction and empower families on how they can accelerate their child's learning and really support their children. And so I don't have an easy answer to this, but I do think that that's something that we need to be more intentional about, especially during COVID, is how we're communicating with families about their role, especially during this time at home.
Marisela, you always have been elevating the work of programs like home visiting, right? We're listening, fear, the need for trust with families, right? And you've always elevated the importance of that program for immigrant families.
Yeah, thank you, Jose. We have found throughout the years that that is the first step of engaging the families, that if they are reluctant because they don't trust the systems that, and the message that society has given to immigrants that they're not welcome in this country, unfortunately, that rhetoric has been escalating during the past 4 years, to the point that families are really reluctant to trust the institutions that are designed to help their children. So what we notice is the significant appeal that then home visiting has for immigrant families, mixed status families. And I think that once they develop that trusting relationship, they're more willing to move their children into our center-based programs. So it is a stepping stone. Some of them decide that it is good for them to just keep them in the home visiting program longer, but we have seen that that's a very effective strategy for us, for Getz Hill Center.
Wonderful. I want to take us to the next few slides before we dive deeper into, I think, more specific nuances around COVID, which I think have already started to bubble up a little bit. Bill?
Thank you, Erica, and thank you, Maricela, for your contributions, and thanks to everybody for your valuable input. Now, Maricela spoke about precarity and poverty, and what we see when we look at statistics by median household income and wealth, we see that there's some very significant disparities in terms of the amount of money, the median amount of money that households bring in, depending on the race or ethnicity of the householder. We see it's lowest for Black Illinoisans, and although Latinx Illinoisans bring in more money, or just as much money as some other groups here, they're still significantly lower than the overall amount that Illinoisans bring in, and significantly lower than for example, Asian Illinoisans and whites who are not Latinx as well. Now, when we look at median net worth of households, Maricela was talking about, the effects of poverty in people's lives, and that has a lot to do with the kinds of financial resources people are able to draw upon, especially in times of crisis. In 2016, this is data for the entire US, the median net worth of households we see is extraordinarily low for Black Americans, folks who identify as other in the Census Bureau, and for also folks who are Hispanic origin of any race. Now, if you remove the net worth, if you remove home equity in these data, for folks who are Hispanic origin of any race, that number decreases from about $21,000 to about $7,000. And for Black Americans, that goes down to about $3,800 of median wealth. So, if you don't own a home, then your median wealth is probably going to be significantly lower than what we see here in these charts. And in the context of COVID-19, people's median household income in many cases is going to completely collapse. Now, we don't know the scale of this quite yet because the data aren't out yet, but if we look at the chart on the left, we can fully expect in a few years for people's median household incomes to decrease very significantly. Finally, just in terms of food insecurity, we know that the percentage of folks and percentage of children in particular who face food insecurity varies from county to county. But we can see kind of what that food insecurity might look like. It's not, the data on food stamps and SNAP is not a stand-in for that, those data on food insecurity, but we can kind of see who's utilizing food stamps and SNAP benefits and who needs those kinds of resources. And we can see that people of color utilize these resources far more than other groups here. And again, in the context of COVID-19, we fully expect for these numbers to increase then significantly as the data continue to come out about it. So to talk about the effects of the impact of COVID-19, Erica Mendez will now take the reins. She's the Senior Education Policy Analyst at Latino Policy Forum. Go ahead, Erica.
Thanks so much, Bill. Now, I know the data presented throughout this webinar is staggering. I don't think it's something that's entirely foreign to a lot of folks on this call. And, you know, as we talk about those inequities and our role in finding ways to narrow some of these gaps we see, we know that the data isn't going to fully illustrate what we're facing until the years to come. There isn't a way to quantify that now. It's just things that we know anecdotally and from what we're seeing in the community. But we do have some early data that's giving us a roadmap of what to expect for communities across the state. Here on this slide, we see that Latinos and African Americans by far have the highest COVID positivity rates per 100,000 population. Positivity rates for African Americans is almost twice as much as those for whites, and positivity rates for Latinos are 4 times more than that of whites. Next slide. And this is just a kind of a heat map to demonstrate areas where there is 25% or more concentration of Latinx population with COVID positive rates. Next slide. And although the pandemic is disproportionately affecting Black and Brown communities throughout the state, we know that there's heightened public health risks in certain areas, primarily in the city, but also outside of the city in different suburbs where we do see that there's a concentration of Latinos. Next slide. This graph here shows us what I just mentioned by zip code instead of this heat map. And so as we see, Latinos do pose, have very, very alarming rates, not just in terms of positivity, but also death and testing rates by zip code. And so I think there's a state threshold for, you know, when is it safe to begin reopening services? And it was at 10%, if I'm not wrong. And we see that different groups here far exceed this 10% threshold. And so when we begin thinking about how safely are we reopening and what resources are going to be needed in order to really get back to a point before COVID, we need to be really intentional about how we prioritize areas where we see there is heightened public health risk. And as I think was alluded to by Bill in earlier slides, a lot of this happens because we know that families are going out to work and are working in industries and areas of work where there isn't an opportunity to social distance or isolate themselves. They're working in industries where there's quite a bit of exposure to the virus. And so what that means when they come home and their ability to stay safe during these times is severely, I think, impaired and something to be thought of. Next slide. This graph here shows cases, COVID-19 cases by death and rate. So relative to our percentage of the state population, Black and Latino deaths related to COVID are overrepresented. While Blacks make up 15% of the entire state population, the death rate for them is 27%. And Latinos make up 17% of the entire state population. However, 20.5% of COVID-19 deaths are attributed to Latinos. And this graph just shows that percentage of Illinoisans living in homes with more than one occupant per room, given social isolation and quarantine, is recommended. This kind of, it doesn't help the spread. We see that Latinos are more likely than any other racial ethnic group to be unable to social distance at home, likely living in dual generation households. And here we see that 9% of Latinx, don't have that luxury in the space that they're in to be able to take these protective measures for themselves. And lastly, we know that the pandemic has surfaced a lot of inequities for families across our system, particularly in this slide, highlighting some of the financial losses and stressors that they're experiencing. A lot of it alluded earlier by Maricela, and some of the direct needs her social service organization had to respond to in order to keep families afloat during the beginning of the pandemic, and have had to find creative ways to sustain that support throughout. We found that many Latino households face economic challenges that aren't just affecting their financial, but also their physical and emotional well-being, and that these inequities are likely to be exacerbated in the months to come without any further relief from either the state, or the state needs more federal relief from the federal government.
Thank you, Erica. Yeah. Oh, I'm sorry. Continue.
No, I just wanted to highlight one stat that's on this slide, and it's just that 58% of Latino households in Illinois have experienced either job loss, pay cut, or 15% experienced both job loss and a pay cut. And so obviously, families need this lifeline in order to sustain their entire households. And so if we're really thinking long-term about how we're supporting children to be successful, we really have to support the families and the different areas of support that the families need to thrive.
Thank you so much, Erica. And up next to go over some of the recommendations that we made in the 2020 Kids Count report is Mitch Lifson, who is the Vice President of Policy from Voices for Illinois Children.
Thank you, Bill. And I was also just looking in the chat box on some questions regarding the last section. I'll also just point out, Erica pointed out the percentage of households with lost income. There was also a report that Telemundo and NBC put together that ran, which suggested too that because the way that unemployment benefits are claimed and the inability of some households to access them, it may also be keeping people in the workforce in order to prevent a loss of wages. That may be contributing to some of the COVID cases. Mm-hmm. The other thing to point out that may be related to that is that on the number of positive COVID cases, you see it higher in younger ages, middle-aged families for Hispanic and Latino households. And there's a higher percentage in that middle age range for Hispanic and Latino households. But then when you get more past 65 years of age, African Americans make up a larger portion in the number of people dying from COVID-19. And that may have something to do with underlying health conditions too. So with regards to our Kids Count report, because we're trying to look at the disparities that exist in many of these health metrics, it was not just a matter of collecting census data, but also contacting state agencies for information that was disaggregated by race and ethnicity. And we ended up finding, unfortunately, that in a number of cases, the state agencies didn't have that data readily available or didn't collect it. One example is with regards to the All Kids program, which provides the healthcare insurance for children in the state of Illinois. In the case of asking the race of the participant in the program, the enrollee, 50% listed unknown because it's not mandated to collect the race or ethnicity. When it came to asking about ethnicity, unknown was 32%. So when we're taking a look at how we're applying the resources that the state has to healthcare programs and whether we're reaching out to the right populations in the right manner, it's difficult to match it up with the eligible population if we're not collecting that data. And that kind of example is seen throughout different state agencies. There's currently a law that requires the Illinois Department of Human Services to collect demographic data for those to whom it provides services to. We would like to see that law extended to other agencies such as Department of Healthcare and Family Services or the Department of Public Health, again, to make sure that we're meeting the needs and maximizing our resources. Also, with regards to resources, we found that in areas where there were school-based health centers, they were providing a benefit not only to the young people who were enrolled in the schools where the health centers are based, but others in the community as well. And we think that looking at that as an avenue for delivering healthcare is something that should be accentuated in the state of Illinois. Now, when it comes to the All Kids program, the majority of children in the program are enrolled in managed care organizations. And these organizations then present surveys to the clientele to see how they're serving them. And what's interesting to note is that for the data we collected when there were 7 MCOs operating, when it came to access to healthcare for children under Medicaid and access to healthcare quickly for children under Medicaid, parents rated the MCOs at the lowest possible ranking compared to national standards, except in one category. And so we think this is a warning sign, and healthcare and family services should delve into this data more closely to find out what exactly is at work. Is it the lack of healthcare providers that will see Medicaid patients? Perhaps it's a transportation issue. Again, if we can get them to operate more effectively, it should help improve the health metrics for children. We also found that in a number of cases where community-based mental health systems had been devised, they were very effective in identifying mental health needs as well as developmental needs early on. The Illinois Children's Healthcare Foundation has been setting up a number of these networks across the state, and we think taking a look at that is very instructive because not only does it integrate the services, but again, it's providing an early identification. Bill mentioned the stark differences in infant mortality. There is a task force that's supposed to report its results at the end of the year, particularly with regards to the high rate of African American infants who are dying. We think the state needs to take that report and earnestly look at how it can make improvements in our healthcare system that may involve providing additional prenatal care to mothers. And finally, to the whole picture, what we're talking about, not only with health generally, but in this COVID situation and with what the federal government has made available, because some people either cannot access benefits or the benefits have run out, and in particular, if there's no further federal stimulus package, then we think the state, even when it's difficult financial circumstances, is going to have to ask itself for the remainder of the fiscal year, what can we do for additional housing assistance? What can we do for additional food assistance and paying utility bills as winter is coming upon us? And perhaps there is something with the TANF program we need to look at long-term or short-term for additional income assistance, either for people who can gain access to current programs or cannot. And certainly, and we can talk about this a little bit later, one of the questions in the chat box was, how has the whole discussion about public charge impact accessing these programs? I think most people would agree it has had a chilling effect. And we just need to work to overcome the immediate needs for those families as they currently exist. So Bill, if you want to go to the next slide. So the biggest recommendation we can make to everyone, and this is probably for those of you on the call stating the obvious, we need to get people in the next month to comply with the census. The census overall, data is used directly or indirectly in terms of setting qualifying levels for distributing some $1.5 trillion to state, local governments, nonprofits. And it has an impact on Medicaid eligibility, how the CHIP program works. Hospitals use the data in determining the assessment of the community and what services to provide. The WIC program is just another example of how the census data is used for determining the qualifying level and how much to give each state. So even though this is 1 year for the census, the impact and what the results are will last for the next decade, and it can have a significant impact on the healthcare system in the state of Illinois. Next slide, please. So I just wanted to give you one small example where perhaps you can kind of draw a line on the census and healthcare. So the 4th Congressional District is, excuse me, I believe it's 60% approximately Hispanic and Latino. And you can see in this particular district that more than half of the children rely on Medicaid. This particular district, as of a few days ago, has a census response rate that is below the statewide average. So again, when the results come in, it's not going to measure the income and the needs of those families accurately within that area because of the low census response rate, and that very well can impact the Medicaid program, which is serving half of the children in that area. So if there, I know we will have a calls to action, the last part of this conversation, but perhaps at the top of the list, one of the best things I could recommend is please encourage anybody within your network to get out the word over and over again that 1 month is essentially left to comply with the census. And if people have not filled out their forms, please do so. Next slide, please. And I believe we're going to turn this over to Jose. Is that correct?
Yes, thank you so much,
Okay.
Mitch. Yeah, can you all hear me?
Mm-hmm.
Yes. Well, thank you, Mitch. Thank you to the other speakers. It's really so interesting to see where the pre-pandemic conditions of the Latinos that would give us kind of all those clues of how this crisis was going to play out in this community. Pre-existing health conditions, right? Low health insurance rate, poverty overall. These disparities, as Mitch was mentioning, can only be widened if we're not able to increase the response rate in the census in Illinois. And we need to get the word out to that universe of people that we have that have not filled out yet their census form, right? And because the impact of not receiving the amount of dollars according to the population goes beyond 2021, it will impact us in the next decade, but beyond that too, right? So let me do some math here and bear with me because I know that you've seen plenty of numbers today. In 2016, more than 2 million Latinos were living in Illinois. That is 17% of the state's total population. And in the last census count, 1.5% of those were missed. That is 35,670 people, 35,670 Latinos. Annually, we lose $1,400 per person missed and per year. If we multiply these numbers, Illinois will lose in the past 10 years, $457 million. $457 million. And that is only if we miss 1.5% of the Latino population, $457 million. Next slide, please. So one main focus of the Latino Policy Forum in this census campaign that we've been working on for the past months has focused on children birth to 5, right? We know that the census consistently has undercounted children from birth to 5 at much higher rates than any other group. So in 2010, and this is national data, 1 million children were left out of the census. Of those, 400,000 were Latinos. And remember, this is national data. But only in Cook County, 11,000 children were missed. All this to say how important it is to increase our collective effort and increase that response rate and ensure that children and families across the state get the funding that they deserve. I think Abby was asking in the chat box if we had any resources in Spanish to help Latinos, Spanish-speaking families understand that this is safe. Well, the Latino Policy Forum has been creating around 10 fact sheets, bilingual in Spanish and in English, responding to the common questions, right, that people might have and the common concerns that they might have. We did it in Spanish and English. We also have some memes for social media. And we even created a census-related loteria game, right? So the families could be playing while learning around the census. So we will for sure be sharing again with all of those partners. Right now, more than 130 organizations have been, that all of them have been doing a great effort around census, right? Has been sharing this materials. I'll post the link in here in the chat box. It's tuthenso.com, although you can also do it, it's more complicated. It's also in the Latino Policy Forum webpage, but tuthenso.com. I'll put it in the chat box right away. And lastly, I'll just want to mention, Erika was talking about the Chicago zip codes where there's a prevalence of COVID cases and the socioeconomical impact that it's having. It's interesting and really concerning to see some of those zip codes have the lowest response rates. The response rate as for yesterday in Chicago was 57.8. Well, we can see Gage Park, 49.9. Humboldt Park, 45%. South Lawndale, 39.2. Brighton Park, 46.3, right? And the list goes on and on, but it speaks to the need to concentrate the efforts in those community areas that have been more impacted by the COVID, and at the same time, they're gonna be suffering that lack of appropriate investments if we're not able to pull up those response rate numbers. Thank you so much.
Thanks, Jose. And I'm going to kick it back to Mitch really quick to talk about the role of the Illinois Early Childhood Funding Commission.
So in terms of other steps that can be taken to address some of what we've seen in the presentation, earlier we were speaking about the low access to early childhood programs, whether it's for language reasons, accessibility in terms of distance, cultural issues, and currently the governor has a commission that is looking at how we fund childcare and early education in the state of Illinois. And it's asking itself, given all the different programs we have, should we look at constructing it differently, how we administer it? Should we all bring it under one roof? Are there different ways that we can blend the funding streams? And it's working on a calendar to provide its recommendations by January. If you have not weighed in on any of this, I would strongly encourage you to do so. I mean, I think it's very instructive in the conversation we were having with Maricela and others, how home visiting is really a connection between the household and then getting a child perhaps into a center-based program. I'm not sure if that particular point of view perhaps has been stressed enough to members of the commission during its deliberation. We have presented some of the data we presented to you today to the commission, asking them to please look at this from the perspective of not only the accessibility to a program and how many are participating, but the latest kindergarten assessment data. And the latest round just came out yesterday, which shows, again, when you break down by race and ethnicity kindergartners based on the assessment of their teachers, Latino and Hispanic households, in terms of preparation in the areas of social and emotional development, math, and education, that combined, those combined three areas, Latino and Hispanic households are the lowest rated group when it comes to preparedness. So that again should be a guidepost as to perhaps how we develop the system going forward and for the future. And the working groups of the commission are putting together their recommendations to forward to the full commission for its consideration and either approval, amendment, or rejection. And again, I would urge you to weigh in through the early childhood website of the governor's office, or if you just Google the commission, you'll come to the contact page and provide any comments with regards to how you want to see the system develop. Because again, this could be the blueprint that the legislature and the administration use for the next several years on how to proceed. So Bill, I'll turn it back over to you.
Thank you, Mitch. So if any of you are interested in looking at the data or comparing Illinois to other states in the nation, you can feel free to visit the Kids Count Data Center at that web address there, datacenter.kidscount.org. If you really enjoy the dulcet tones of my voice, you can also watch a instructional video that we put up on YouTube that will show you how to access various kinds of data in categories such as socioeconomics, education, family and community, housing, et cetera, and so forth. We have 400 indicators in all of those areas there, most of which are updated by the Annie E. Casey Foundation, but about 100 of which the Voices for Illinois Children is responsible for. You can also feel free to get in touch with any of us at Voices for Illinois Children or the Latino Policy Forum, and we'll make this presentation and contact information available to everybody after the conclusion of the presentation. But before we get into the question and answer session, we'd like to hear from Dr. Arecia Martinez Cardoso, who is an assistant professor in the Department of Public Health Sciences at the University of Chicago. And she's going to help kind of tie a lot of the statistics that we saw today together and talk about children's health outcomes by race and ethnicity. Doctor?
Hi, thank you all for having me. I don't need the slides. I don't want to stare at my picture, but yeah, thank you. So it's a pleasure to be here and add my remarks to the conversation. So I was asked to provide some context to some of the findings in the report and perhaps point to avenues for intervention either through practice or policy or a combination of both. I want to point out that, of course, I've read the report, but I wasn't part of putting it together, but it's a fantastic and well done report. So first, in the report, you see that there's a number of health and social outcomes that are parsed out by race and ethnicity, and that was also presented today, and that there are a number of inequities faced by both Latinx children and Black children in the state. So as a researcher, when we see inequities by race, we often say that it is racism and not race that causes these disparities. And I really commend the report and the folks here for highlighting the deep social inequities faced by communities of color in Illinois that in turn shape many of the health inequities that are documented. So when we say that racism caused this, what we're saying is that systems of racial hierarchies in our country pattern the opportunities and the structures that shape Latinx and Black kids' lives. So it's racism, right, that shapes one's socioeconomic status and their resources, their family networks and their relationships, their health behaviors, and the context of their lives, including the neighborhoods, the schools, and the workplaces that they reside in. So in this report and in a lot of the data that we have, we really only get a small snapshot into many of these more upstream or explanatory factors, but we do the best that we can to try to unpack this data and really understand what are the causes of these things, because it's not race or ethnicity per se, it's all of the constellation of factors that are impacting the lives of these racial and ethnic groups. So I just want to start off by underscoring that. So the first trend that we consistently see is that, this wasn't presented so much today in the slides, but it is more in the deeper parts of the report, is that when we look at families across similar levels of poverty, many Latinx children have better outcomes on a number of factors in comparison to Black children in similar socioeconomic circumstances. So for example, you saw in the slide that adverse birth outcomes are really high among Black women as compared to Latinx women. Asthma rates in the report are really a lot higher among Black children compared to Latinx children. And that, poverty doesn't explain like why this is happening. So first I'll say that this is kind of a phenomena that is found repeatedly in the research. It's often referred to as the Latinx health paradox or the Latino health paradox, where we find that across a number of outcomes, Latinos do better than we would expect considering their socioeconomic status. So I don't have a ton of time to unpack this whole kind of research phenomena. We've documented it since the 80s. But what I will say is that often this is due to immigration status, but it works in the opposite way than we would expect. So it's often immigrants or the children of immigrants who fare the best on a number of outcomes compared to the US born. So if we were to parse out this data that we see today by migration status or household migration status, what we would often find is that immigrant children or the children of immigrants would do the best, and then the US born would kind of be right here, and then often Black children who are US born or their parents are US born are here. And so what that is telling us is that that if we look at the features of the lives of those children, that the experience of poverty and the experience of race is qualitatively different for these groups. So in the report, for example, Black children were more likely to experience concentrated poverty as well as a number of the other ACEs. And so what it's saying is that if you put families in difficult circumstances for generations and continue to disinvest in communities in which they live, we will see the legacy of these injustices on their lives and their bodies. So if we were to parse out this data, we often will see that the US-born Latinos often experience some of these persistent disadvantages across generations, and that's happening to them too. So what does this mean? So it means that we need to parse out our data a little bit more to understand these phenomena. We also need to think about what is working for immigrant families and try to maintain whatever structures that helps them thrive, and then reinvest in the structures to do the same for Black children and US-born Latinx children. So the second thing that I wanted to point out in the report is that Latinx children, as we saw, lag a bit with respect to health insurance access compared to other racial ethnic groups. So on the one hand, we're kind of doing okay in our state because Latinx kids do have higher rates of health insurance relative to Latinx kids in other parts of the United States. So our rate was like, uninsurance rate was like 4%, and across the country it's around 8% for Latinx children. So we're doing a little bit better. And part of the reason of that is that Illinois, of course, has expanded Medicaid, particularly to undocumented children. But the other piece is that when we expanded Medicaid, we really want to get their parents covered as well, right? And so we saw that there's really big gaps in access to health insurance for many parents. And we know that when we get parents covered, we often get kids covered as well, and vice versa. So we need to think about ways that we can expand public insurance options, especially for low-income families and undocumented folks. So I come from the state of California, and there's already a lot of conversations around the state expanding their public insurance programs to undocumented adults. The other thing to pay attention to is, what wasn't so concerning to me was this gap, but also that the rates of uninsurance have been increasing across the nation and within our state for several years. And so studies have shown, that the ACA really reduced rates of uninsurance, but some of those inroads that we gained, we're starting to lose that. So I think we really need to pay attention to increasing rates of uninsurance in addition to the gaps. And part of the reason that this is happening is obviously, the mandate for insurance that has been removed from the law, so people are no longer required to have insurance. But also, there's a lot of the current administration has been very creative at undermining public healthcare programs and creating a lot of red tape. And then for Latinx families specifically, one thing we talked about was that the immigration policy environment has really deterred enrollment in these programs, even if they qualify, because there's concerns, right, among immigrant families that might be considered a public charge, or that they might be monitored in some ways. And so both of these things that are happening, right, the immigration policy environment, as well as kind of the red tape things that are happening to undermine public healthcare programs, now more than ever, we need our social service organizations to do what they do best and really help families navigate the red tape and the myths about enrollment in these programs, because they truly do qualify. And what a lot that we know about public programs is if we get families into one, we can often get them into many, right? So if we can get them into health insurance, we can get them into SNAP and then early childhood education, and so it cascades, right? So we have to think about multiple entry points for folks, and health insurance as being one. Oh, and thank you, somebody did correct me on expanded Medicaid coverage for folks who are undocumented. Thank you for that. And then the last thing I'll comment on is this observation around Latinx children's enrollment in early childhood education. So we see that they're less likely to be enrolled in early childhood education, they're less ready for kindergarten, and then later on, the report shows that Latinx children struggle with math and reading scores. And so when we start them off, when we start kids off early, we know that in early childhood education, it really just sets them up for success later on in terms of their education, but also their short and long-term health. So there are a number of factors that shape kids' access to early childhood education, including both the availability of facilities and places to send kids, as well as parents' decisions to enroll their kids. So one report by the Center for American Progress shows that the majority of Latino families across the country reside in childcare deserts. So it's either places where there are not enough facilities or there's not enough spaces in the facilities. So I would be curious to see whether that's something that's also happening in Illinois, if it's a factor of, is there enough space and enough facilities for all of these children? And then the other question is whether parents want to even send their kids to these places. And there's a lot of myths that Latino parents don't want to send their kids to early childhood education centers. And in fact, the evidence is pretty mixed, but these days, what we're finding from a number of different reports, just one that I read from the National Research Center on Hispanic Children and Families, found that Latinx parents were just as willing to enroll their children in early childcare as Black and white families. But what they often report is that they didn't have sufficient information on how and where and when to enroll their kids in these programs. So again, it's not necessarily people don't want to, it's that they just don't know how to do it and how to navigate those systems. And then in a similar report that looked at kids in CPS when they were in kindergarten who had gone to preschool before they enrolled in kindergarten and CPS, when they looked at all families across race, ethnicity, and then when they controlled for socioeconomic status and whether people participated in public programs in the past, they found that in fact, Latino kids were more likely to enroll in early childhood education once you took into consideration these two factors. So we really need to be focusing on low-income kids. And again, we really need to think about on-ramping families into a number of different public programs like SNAP, like health insurance, and that will help us get them into things like preschool early on. So this, the kind of home visit program is one good example. If we get them early and often, by the time they hit age 3 or 4 or 5, they're more willing to engage in these programs. So that's always kind of the message, right? Early and often is what really works. And then finally, in the last couple minutes, I really want to echo the sentiments of our colleagues about the importance of the census. Not only does it shape the figures and the data that we get from the census, shape policy and funding and the resources across our districts, but they really are an indispensable tool that researchers like myself use to understand our communities and health factors and risks and really think about what's coming ahead. And there are always a lot of worries about people sharing data with the government. And what I will say is I've worked a lot with census data and with the census administrators, and they are quite, they're their own kind of entity. They take their work very seriously. It's a lot of well-trained policy researchers that really respect the data and respect data confidentiality in ways that I don't see in other institutions. So people very much take this, so it's very much not a part of the political environment, right? It's its own kind of independent entity. And then the other thing is that this might not be encouraging, right? But all of our data is already out there anyway, right? So if you're on Facebook, if you're on Instagram, right? If you're on Google, Gmail, like all these families, if you're, all of that data is already out there about us. And so we just need to arm our government, right, with data for public good, right, as opposed to like Facebook to sell things, right? So there's so much data already out there on these families anyway, but we would have to pay Facebook, right? The government would have to pay millions of dollars if we wanted that data. So the census allows our government and our policymakers to have the decision as a public good. And so it's so important that we share that with folks as well. That might not be helpful to folks, but it might be just like word to the wise. So I'll stop there, but I'm really happy to share my insights on any other aspect of the report that I wasn't able to discuss, including COVID and infant mortality. There's just so many issues facing our communities. And thank you for allowing me to share some of my thoughts.
Thank you.
Thank you, Doctor.
Anybody who has any questions, please type them in the chat box. We have a few minutes to try and get to them. And I will reiterate that any information you provide to the Census Bureau is confidential, and any private, personal, identifiable information cannot be released until 72 years from now, when some of the information is sent to the National Archives for research purposes. So please don't worry about use of the data in that fashion. Anybody have any questions? Last call.
Hi, this is Amy Eisenstein from Council for a Strong America. I have a quick question about the Kindergarten Individual Development Survey, the KIDS data that was recently released on Monday.
Mm-hmm.
I noticed a disparity between last year's data and this year's data. I think it's 26% of students were English learners in the previous year, and they only noted that 17% of students were English learners in this year. And I was wondering if that was just like a hiccup in the way that they classified English learners, or if it might point to some larger trend, or if anyone had any thoughts or concerns about that.
Well, I'll just say that I would need to take a look at how many children were part of the assessment pool, because I know that in the first 2 years, they did not capture all the kindergartners in the state. So I don't know if that has anything to do with the makeup and how the percentages came out, but certainly I open it up to anybody else who might have insight. All right, but I will make it a point to follow up with the State Board of Education and see what their thoughts are on the matter.
Thanks, Finch.
Mm-hmm. Okay, then, Erica, I'm going to hand it off to you to wrap us up.
Well, I first and foremost want to thank our speakers, Dr. Aresha Martinez Cardoso and Marisela Garcia, for really taking the time, and I think adding some nuance to some of the data. I know we see it and it's startling, but we really want to humanize it, because those are families that we really want to support, and we don't want to lose them through the cracks, especially now during such a challenging time. We also want to remind folks that this webinar is going to be recorded and made available online, both on our websites, but we'll also try to follow up via email to make sure that you have those resources and tools at your disposal. If you do have a lingering question or a comment, or would like to discuss some of this a little bit further, please feel free to reach out to staff both at Voices and Latino Policy Forum. We want to provide as much support as possible in your own advocacy and practice. And wanted to thank all of you and respect your time this morning, giving you 3 extra minutes to your day, and hoping that you have a wonderful and productive week.
Thank you all.
Thank you.
Thank you.
Thank you.
Thank you.